February is Heart Health Month, and today we have a special guest, and that's Dr. Shenoy, the medical director of Wolfson's Children's Terry Heart Institute. Welcome to River City Live. And it's one of those things, it's Heart Month, and it's always good to learn about the heart, right? It's super important. And today our focus is congenital heart disease. So what exactly is that?
Well, first of all, thank you so much for having people from the Terry Heart Institute over at your studio. Congenital heart disease is heart disease essentially that you're born with. And it usually comes as a big surprise to patients and their parents because generally we assume that heart disease is something you acquire as a result of lifestyle choices like obesity, poor eating, or smoking. But congenital heart disease is something you're born with. It is the most common birth defect. About 8 in 1,000 babies are born with some sort of heart defect.
And then how is it diagnosed, and when is it diagnosed?
Well, that's a good question, and the answer really varies. For critical forms of congenital heart disease, the diagnosis is made even before the baby is born. At the Terry Heart Institute, we have a fetal heart program which coordinates very closely with maternal fetal medicine specialists. They are usually the first ones to detect a significant abnormality in the developing fetal heart that usually prompts a consult with a fetal cardiologist who then makes the diagnosis and counsels the parents about the implications of that diagnosis. Needless to say, there are also milder forms of congenital heart disease which can be diagnosed after the baby is born, sometimes as late as young adulthood.
Are there any specific signs or symptoms where that happens? Let's say a baby kind of slips through the cracks, nothing comes up on imaging, and then all of a sudden, maybe a toddler or, 6, 7 years old. What's something a parent would look out for where that could be the case?
Yes. So in the first few months of life, if your baby is having a hard time breathing, if the baby's lips look dusky or the tongue looks dusky, and if the baby has a tough time gaining weight, that should prompt a discussion with the pediatrician about whether this could be the early manifestations of congenital heart disease. Later on in life, if you feel that your child is unable to keep up with their peers or experiences chest discomfort, especially with exercise, you might want to talk to your pediatrician about a diagnosis of congenital heart disease.
One thing that's, I think, really important, being a parent, whenever you're with your pediatrician, don't be afraid to ask questions, because a lot of times they're going to do, the health screen and all that stuff, but bring some notes. Better safe than sorry, and go through things, because they might not seem like that big of a deal, but it could be a little trigger to further explore. So just something I feel like is a good thing to do.
Absolutely well said.
What about as far as treatments? What are the options?
So if the fetus has an arrhythmia where the heart is beating very fast, we can actually medicate the mother and treat the arrhythmia in the fetus. A structural heart problem where there's a hole in the heart or a valve doesn't perform very well may have to wait until after the baby is born. And I would like to break down treatment into different boxes. You could have medical treatments, like you give the baby medications or supplement the baby's feeds with extra calories to help them gain weight. If that fails, then we might have to do something more invasive. This might not necessarily mean surgery. Some lesions can be dealt with by interventional cardiologists who can actually close holes in the heart or actually open up valves that don't open well in the cardiac catheterization laboratory. So the child doesn't even need surgery. But clearly there are severe forms of congenital heart disease where the only option would be surgical management of that heart condition, which usually involves an incision on your chest, opening the breastbone, and taking care of the heart lesion.
Well, it sounds like obviously there's a lot of different solutions out there, and everybody will be unique based on really what the problem is. Dr. Shinoy, thank you so much for coming out here and educating us on congenital heart disease. To learn more, you can give them a call at 904-202-8550, or you could go online, wilsonchildrens.com/heart. Thanks again, we appreciate it.
Thank you very much.